Good morning. I should say, first of all, that I'm back 20 days today. So tomorrow I will be, I'll know for sure that I am Ebola free. Having said all of that, you know, having been just back and listening to David this morning, there was nothing that I did during my trip in both Sierra Leone and Liberia that would have put me at risk of getting Ebola. And you know, there's I suppose a whole panic out there about Ebola and what it does and who can get it and who should be locked away, and putting people in quarantine for 3 weeks when they step off the plane from West Africa is a little bit of an exaggeration of care, I would say. I suppose from Concern's point of view, we've been working in both Liberia and Sierra Leone since the mid-90s, and I worked in both of those countries at the early stages. At the onset of the outbreak, we had a choice. We could either withdraw and hibernate, like many agencies did, or we could look at what our strengths were as an organisation and engage to do something. Our strengths are not in the provision of medical care. Our strengths are very much in the primary healthcare sector, in social mobilisation, in looking at what messaging to get out there so that people can protect themselves, so that early response and case identification can be made, so that cases who were suspect could be isolated and assessed and treated appropriately. And I suppose we felt very comfortable in that role in the early stages, and we sort of felt, okay, this is something we can move on with, this is where we should be focusing our attention. There was other aspects that we had to look at. We had to look at the health and welfare of our staff within the offices of both countries, put hand washing facilities in place. The minute you go into the office every day, you get your temperature taken, you wash your hands. The offices, the facilities were swabbed and wiped down on a regular basis with chlorinated water so that there would be no contamination. We were conscious of the fact that many of our staff came and lived in communities that had cases of infection, so we still had to continue to put those protection measures in place. We also looked at, instead of staff coming to work by bus, where they could potentially be sitting close to somebody who could infect them, we had to put on transport to enable our staff to get in again safely. So those were the measures within Concern. But then for our broader programming, as I say, we were very comfortable in the social mobilisation space. But then, of course, we went down the road of contact tracing. So that brings us a little step nearer. And you're getting up close and personal with people who may have had direct contact with Ebola cases. And gradually, I suppose, we saw that we were going far beyond the boundaries of what we would normally do in terms of our programming in places like Liberia and Sierra Leone. The agencies, the health-specific agencies, the treatment agencies were gearing up dramatically and doing a fantastic job. Margaret mentioned MSF, and I have to say MSF have done an outstanding job in looking at the provision of curative care. So have IMC, CDC, the Disease Control Centre in Atlanta, also stepped up to the plate, as did WHO, and there was a real sense, and there still is a real sense of cooperation and sharing and partnership in both of those countries that I have not seen before in emergency situations. Very often emergency responses in the past have been much more around flag planting, you know, the war of the t-shirts. We had a lecture on branding yesterday. In this case, it wasn't the case, and everybody was sharing their materials. There was great encouragement to do more. There was agencies were happy to provide training for other agencies to gear up. We have done enormous training on community mobilisation and psychosocial support. But I suppose the big thing about this illness also is that, you know, driving through Sierra Leone or Liberia, what struck me was that, first of all, the marketplaces and villages, you had grass growing up through the rural markets. The kids were everywhere because the schools were all closed. Rural markets had shut down, schools had closed, and therefore where do people go to sell their food? Where do people go to buy food? And we have a knock-on effect of price inflation, and again it affecting the poorest in society. Schools, we have worked with the Ministry of Education to look at how to develop curricula that can be transmitted by community radio. It's not going to solve the problem, but it is going to in some ways address kids that are possibly out of school for 6 months to a year, missing a crucial part of their education. In the whole market structure, the markets in both the capitals are now back and working and are vibrant, but the rural markets have yet to kick in. From our own programming perspective, of course there is the identification, the extraction, the isolation, the contact tracing, the treatment, and then there's the safe disposal both of waste material for the living, but also the dead. And again, for concern, we went down a route that we had certainly never taken before, and this was around the whole issue of dead body management. And we've taken on the dead body management for Freetown. And again, it was a big area. We're working very closely with the Ministry of Health. We've taken on the Ministry of Health teams. We are operating fleets of cars, and we are managing a couple of cemeteries. And again, when we're talking about partnership, I thought, okay, who are the experts? And one of the experts here, of course, is Glasnevin Cemetery. So I went to visit and met with the CEO and the Deputy CEO of Glasnevin Cemetery, and they were hugely helpful. And what I hadn't realised is that Ireland, of course, has a big epidemic management plan, and you know, they planned it for SARS some years ago. There's been the swine flu outbreak. There's been so many things. Glasnevin had all their plans in place, and they were more than happy to share. We learned how to lay out a cemetery, how to manage, how to label. We wanted to, I suppose, in many ways, restore the dignity in death. One of the things about Ebola is that it goes very much against our natural instincts. When somebody is sick, when a loved one is sick, you want to care for them. You want to feed them, you want to be close to them, you want to look after them to make sure they're as well as they can be. And then when they die, there's a whole ritual to be gone through. We all know these rituals about washing and laying out the body, about the religious ceremonies that go with it. But Ebola changes all of that. With Ebola, you know, you move away from the person, you lock them away, you take them immediately out of the community, you quarantine and isolate anybody who had contact with them, and then when they actually die, you know, the people in the white coats come and take them away. And there was no dignity in that. So we have tried to restore that a little bit by looking at what religions they are, first of all, introducing some sort of religious ceremonies around the burials. We're labelling graves so that families know where their loved ones are. But also we have reduced the waiting time in the collection of dead bodies. And now people who die are being collected on the day they die and safely buried with dignity, and so that people can engage and take the fear out of it. Margaret mentioned the diseases seems to be on the turn, and we're all hoping that's the case, and that certainly bears out the numbers that we're getting from both Sierra Leone and Liberia. We did see it before, and then we saw a second wave. Part of what fueled the second wave was we had bodies being dug up in places like Port Loko and Sierra Leone, where people didn't feel that their spirits were at rest. And that created a whole new level of infection. And we feel that by proper disposal of the dead bodies and looking at how to manage it with dignity, that it gives people a comfort, and it also gives a protection to the community at large that this is not going to happen. So, thank you very much. I'll leave it there. Thank you.